Hello, listeners. A warm welcome to Views on Health. After a very, very long time indeed, we have with us on the program today Dr. Navodha Atapattu, consultant pediatric endocrinologist, Lady Ridgeway Hospital, Colombo, which is the premier children's hospital in the country. As a consultant pediatric endocrinologist, Dr. Atapattu is going to focus on childhood diabetes. From our point of view, from a lay perspective, diabetes is a huge problem in Sri Lanka, definitely the world over, but looking at our country, we have a large number of patients with diabetes. I'm talking about adult diabetes actually in this instance, and it's said to overtake even ischemic heart disease in a few years to come. Now, diabetes in children is something different in the sense that one would not even think that children will have high sugar levels, and as a result their health is going to have huge issues. It's going to impact on their day-to-day lives and so on and so forth. So childhood diabetes is the focus today on the program, and to highlight the situation and how it is being addressed, what one has got to do, and what follows according to medical advice is what Dr. Navodha Atapattu is here to tell us on the program. Over to you, Doctor.
Thank you very much. I think indeed it's a pleasure to talk to you on childhood diabetes because it is a problem at the moment. At least 100 patients per year are being registered as new cases at Lady Ridgeway Hospital alone. There are 2 other pediatric endocrine units in the country, but this is the biggest children's hospital, so we get more patients referred to us. So at least, as I told you earlier, 100 patients per year is getting registered. So the people wonder how children get diabetes. It is actually a diabetes. Most people do not accept when the diagnosis is being made. All over the world, childhood diabetes is on the increase, and the reason behind that is said to be autoimmune. Let me explain a little bit about autoimmune diseases, which means our immune system starts working against our own body due to various different reasons, mainly genetic reasons, and also the genetically susceptible person is more likely to develop autoimmune disorders when they get exposed to environmental triggers. The problem that we don't know is what these environmental triggers are. If we know these environmental triggers, we can prevent it. So, type 1 diabetes, that is mainly children with diabetes have 2 different main types, type 1 and type 2. This type 1 diabetes is due to these autoimmune destruction of the pancreas, which produces insulin. So the basic mechanism is that these children do not produce this hormone called insulin, so their blood sugar level cannot be maintained in the body in the optimal levels. When the blood sugar level goes up, that sugar starts to go through the kidney. So the sugar doesn't go alone, it goes with water. So that is why they get polyuria, we call in medically. So they start passing a lot of urine and they become thirsty. And also when the glucose cannot be utilized in the cells, they cannot make energy. The glucose is needed for energy production. So their energy level is low, so their body weight comes down, and all these symptoms that you see in adults are seen in children. So that is the basic mechanism how the children develop diabetes, that is type 1, which is, as I told you earlier, it is a genetically determined condition associated with autoimmune destruction of the pancreas, which means we have to give insulin. There's no other alternative medicine. The body doesn't have enough insulin, so we have to give it as an injection. Injectable preparations are the mainstay of treatment all over the world. So we cannot think of any other alternative method to treat children with diabetes. That is the most important thing the listeners and the people should understand. We cannot treat type 1 diabetes with tablets like in adults. There's another type of diabetes now children are getting these days because of the obesity. They because of the poor lifestyle pattern, poor eating habits, and lack of exercise result in obesity, which makes them resistant to insulin. Their body does produce insulin, but body is resistant to insulin. Because of that, those children also develop diabetes. They can be treated with tablets. Those are two different conditions. One has to differentiate it by doing certain blood tests. That can only be done by a professional qualified in looking after children with diabetes. So just because the adults are being treated with tablets, children may not be able to cure with these tablets. So based on the type of diabetes diagnosed by the physician or the pediatric endocrinologist or the pediatrician, the treatment differs. And in addition to insulin, they have to follow a healthy lifestyle, balanced diet, exercise, and appropriate medication based on what their blood sugar is. So it is very important that they regularly check the blood sugar level with a glucometer and give insulin as prescribed. And the diet also will be advised according to the family situation, activity level, and what the child would like to eat. However, it is going to be a healthy diet. We don't call it diabetic diet. There's nothing called diabetic diet or disease specified diet. It is a healthy, balanced diet one should follow.
Thank you so much, Doctor, for that introduction to childhood diabetes. Now, from about what age do you detect this, or any symptoms or signs will emerge in a
We
child?
have seen diabetes from age 1 to 18. A child is defined as a person below 18 years. So we have diagnosed children with diabetes from age 1 year up to 16, 17 years. Most of the time 16, 17 years go to adult, but still they are under pediatric age group. So it is a varying age group, but mostly we see them around the pubertal age. Around 8 to 12 years of age is the commonest age group that we see them with the symptoms, but we do have patients who are diagnosed with diabetes around 1 or 2 years of age.
So what are these symptoms that you see when they're 1 and 2?
Same symptoms like in adults: loss of weight, lack of energy, increased urine output, thirst. And if you miss these symptoms, if you ignore these symptoms, they can come with grave, severe disease condition which we call diabetes ketoacidosis, where their breathing rate will be very high, and they have this acidosis. The blood levels will have a lot of acids, and that could be a very severe condition of diabetes. So the advice here is not to ignore such symptoms of increased urine output, thirst, and don't think it is because of the hot weather. And sometimes these children who were, who had toilet trained, who were not wetting their bed for the several months or several years, suddenly start wetting the bed. So that could be the earliest sign or symptom that you should worry about. And this inappropriate thirst, and sometimes lack of energy or loss of weight. So all these symptoms, which are similar to adults, will be seen in all the age groups.
What about the gender? Are girls more susceptible?
There is no gender difference. They are equally affected.
Thank you, Doctor. That's interesting to know that it can be a boy, it can be a girl, and there's no sort of difference there, saying that.
No difference at all. Yeah.
Going on from there, from adult diabetes, as we know, once you get it, it's there for life. You can't get it. You have to control it with your medication and lifestyle. But there's no sort of reversal, so to speak, of the ailment. If at all, it can progress into something more severe. Now, in children, if they start at this age, say 1 year, 2 years, or even in their, say, the age of puberty at some point in time, is it the same thing? Is it there for life?
Type 1 diabetes is there for life because, as I told you earlier, that there's a destruction to the cells that produce insulin, and it is a continuous process that we cannot hold that process, but at the moment people are doing research to stop this. So in the future we may be able to completely stop it, but as of it now, we won't be able to reverse it. They will need lifelong therapy. So they will also get complications like problems in the heart, eyes, kidney, nerves. Those can get damaged if the disease is not under control. So it's very important, especially for a child, to have a good sugar control. Otherwise they will start getting all those adult complications around 22 years of age. That is the age that they are more productive. That is the backbone of our society. So we don't want them to be sick, ill people in the hospital. So we have to control this very carefully, optimally, to prevent all those complications. It can be done, but we need the parents' support, the child's supports, mostly support of the society look at them in a very, very different angle. Sometimes they bully them. Sometimes people don't like to say that they have diabetes, because some people do get bullied in the school, and some teachers don't know that this is something that the child couldn't have prevented, so they blame the child for eating sweets and getting diabetes. That type of situations also we come across. Sometimes certain children are not getting admitted to certain schools because they cannot help them. So this is a problem in our country. I think we have to look at them in a very sympathetic manner. Not that they need any sympathy. I think it has to be empathy. So you have to empathize with them and help them to be proper, help them to follow a proper childhood. Let them enjoy school activities, extracurricular activities. Don't corner them just because they have this disease or this ailment. We have to support them. So we need the support of the society, not only the parents and the child's support, to get the condition under optimal control.
So now when you take type 1, which is common, and they have to be dependent on insulin, how does that work? How frequently has that to be administered? Of course, it can vary from patient to patient.
Yeah.
It's not like one thing fixes it all. It's
Yes,
not that.
exactly. We initially start with twice daily injections, but as the child reaches the pubertal age, they need more frequent insulin to be administered to get the sugar under control. Actually, the best method is to give 4 injections a day. 1 baseline injection and 3 additional injections for the main meals. But small kids we can manage with just 2 injections. At least 2 injections are needed to control blood sugar level.
So that's a lot to do every day.
That's a lot to do every day. They have to check their sugars, they have to take the insulin, and they have to remember to take insulin and take the meal. And they have to remember that with insulin, if they don't eat, their blood sugar levels can go down, and that has to be treated. Then they should know the symptoms of low blood sugar level as well as the high blood sugar level to keep their sugar under control. So a child with diabetes has to think about his or her disease at least 10 to 15 times a day. So it is a lot for a child, and we do give them psychological support. We have to always be supportive because it is a difficult task. You get into their shoes and think about it, that okay, now I have to take insulin, now I'm going to eat, now I'm going to check the sugars, now I'm going to go out and play, so I have to keep my hypoglycemia kit be with me. I have to tell the teacher that I have diabetes, so I need to take the snack before it's too late, otherwise my blood sugar level will go down. So they have to think about this disease throughout the day, not like any other disease. So it is a lot. A child has to go through a lot. The parents have to go through a lot, and it's also an expensive disease. If you are getting treatment from private sector, if you have to pay for these medications, it's a large amount of money. So we do provide all these things free of charge at Ledriche Hospital, Sirimau Bandaranaike Hospital, as well as Karapitiya. There are 3 pediatric endocrine units. So that we try our best to provide all these facilities free of charge. There are situations where we run out of medications and the strips for the blood sugar measurement, but we try our best to give it free.
I'm sure it do, because that is something that we can always be proud of in Sri Lanka, that there is such an excellent healthcare system and free of charge in the government sector. So across the country, whatever the ailment is, there is free medical attention for the population. And even visitors are entitled to it, visitors to our country. So that is something we can be justifiably proud of. And I hope, Doctor, that there won't be a time when you'll be totally out of your supply of medication, but let's hope for the best.
Yes, we are trying our best to get the donors' help these days, and we have a lot of donors who are happy to help children with diabetes with insulin.
And going on from there, now, when you say that from almost day one, or then most probably then 1 year, 2 year goes on, what about the diet then? How does it work now if a child is being breastfed? I don't see any issues where that is concerned. But otherwise, what about the diet? What sort of advice do you give parents?
So it's basically a healthy diet, and we have to find out what food items they prefer to eat, what is available with them, and then we have to quantify it. For that, we have prepared some books with pictures. So with the help of these picture books, we tell them, okay, this is the amount of carbohydrate that you have to take for the breakfast. This is the amount of carbohydrate for the lunch. So likewise, depending on the child's age, activity, pubertal staging, and what other extracurricular activities they do, the diet varies. So I cannot give a prescribed diet so that everybody can follow. It depends on what they have, what they need, and what their growth pattern is. So basically, the theory behind this is that we have to make sure that they get the carbohydrate for their growth. We cannot completely stop them getting carbohydrates, a complex carbohydrate, that we make sure that we give them adequate amount for the growth. And also we advise them not to take too much of sweets. So they have sweets and oily food, fried food is anyway, even without diabetes, is considered unhealthy. So we advise them not to take frequent sweets. But in a situation, I know you are going to ask that, say if a child goes to a birthday party, how to handle that? Yes, we have given ways and means how to do that. If it is a birthday party, maybe in the evening, so they can take some insulin together with that types of foods. We have categorized those type of food, and we have advised them to take insulin depending on what they eat. So the insulin, there is a calculation to do together with the child. So we tell them, say if you are taking short acting insulin, as an example I'm telling. So if you want to take a piece of cake, yes, you can have it with some insulin, and you have to have your main meal closer to those sweets so that the blood sugar fluctuations will be minimized. And also we advise them to go for the better choices rather than going for the sweets, all the kinds of sweets which you can find out in the situation. They can go for healthy options as well. So they do understand, they know their limits, and once in a while, yes, you can become naughty, but most of the days you have to be disciplined. In that case, we can allow them to be a little bit naughty on a situation like this.
Thank you, Dr. Very comforting, and children at the end of the day would like to kind of break the rules, so to speak,
yeah,
and indulge in something that they would love to indulge in, and it's not an everyday thing. So that's nice to know that they have that bit of leeway to cross the line.
Otherwise, they will become stubborn, and you won't be able to have any control over them. If you are extremely strict, and if you completely cut down their sweets, they are anyway going to have it at school. They can ask their friends to bring it and have it in school, so you have no control at all. So you have to give some, under supervision, you have to give some leverage so that they will know what they can do.
Talking about this book that you mentioned a while ago, obviously it's only for the patients, others don't need it. How is it in all three languages in Sri Lanka? It is
in all three languages. It is given free of charge, and they can get this from all these three clinics.
That is obviously because they only they can make use of it, not
Yes,
anybody
only
else.
they can make use of it. Others also can use it just to see how much, what they are eating, and what the calorie count, what the glucose, carbohydrate count is there. And also we advise patients to go through the food labels if they are taking prepared food, so that they would know the amount of calorie or carbohydrate in a particular given meal, so that they know how much to take. But we do not encourage them to go for this artificial, prepared, stored food to be taken frequently.
Doctor, when you talk about a patient, a child, what sort of complications can arise at that young age if proper care is not taken?
If proper care is not taken, the quickest and the earliest complication is the one I told you earlier, the ketoacidosis, where the blood sugar level is sky high and they start breathing rapidly and they become very ill, and the acid level in the blood will be high. So that is several years ago it was considered as a condition which has a 50% mortality rate. Now with the advancement of our medical facilities, they don't die like that, but it is a avoidable, preventable situation, the ketoacidosis situation. The other complications are, if you have a diabetes for a longer period of time and the control is poor, they can have problems in the eyesight. We call it retinopathy. The back of the eye can have damages, and the kidney can get damaged, and the nervous system can get damaged. Those are we call microvascular disorders, and also they have high risk of getting heart attacks, strokes, and also there are certain other situations like dental caries. Even though people don't look at it as a complication, the patients with diabetes do have high risk of getting dental issues. So they have to have a good dental care, oral care as well. And also they can have a poor growth, problems with puberty, weak bones, all kinds of the whole of the body system can get affected if their general health condition is poor, with poor glucose control.
So we have patients in that category.
Few are there. Even though this type of facilities are given, some people listen to certain other advisors which they are comfortable with. So we would like to give them those options if it is rational. We cannot advise irrational medical management. So we have to be rational. So sometimes people don't like to listen to rational things. They would prefer irrational, wrong advices which they would like to hear. So that is a very unfortunate situation. We have lost several children like that. The parents, now it should come under child abuse. The child doesn't know what to take. It's the parents' responsibility to give them proper care. If a parent fails to give proper care, it comes under child abuse. It has to come under child abuse. I think parents should be punished in the court of law if the care is not given to the child. Child cannot go alone to the medical facility. It is the parent who should take the child. So if the parents are ignorant, if the parents do not give appropriate care for those children, it is a pathetic situation. I have come across, and very heart-breaking to see children dying like that just because of the parents' ignorance. It's still happening in this country.
Negligence?
It's not negligence actually.
Ignorance.
It's the ignorance, because however much we advise them, however much we explain them the disease condition, they prefer to, as I told you earlier, they prefer to hear something else. They don't want to accept it as diabetes. Some people have told a few of my patients that no, children won't get diabetes. Doctor must be making up a story. This is not diabetes. Your child can't get diabetes. Children don't get diabetes. So that type of advices also have been given to our patients. So this is the situation in this country, because everybody has to tell something about somebody. They do criticize, they have some opinion. We do have a lot of opinion leaders rather than people who would do some work. So the opinions are too many opinions are there. So our parents also get fooled by those,
yes.
unfortunately, get caught of those.
They're gullible and they believe.
I believe.
Unfortunate. So, Doctor, going on from there, we are sort of catching up on time. Now, this is a common condition. This can lead to more dangerous situations, as we explained. On the other hand, with proper medication, it can be controlled by the needs for life. And will it impact on, for example, in the case of girls, or even boys for that matter, on fertility?
Yes, it will impact if you do not control it. And if a girl with type 1 diabetes, I would say, is planning for pregnancy, the blood sugar control has to be optimized. We check the blood sugar control by doing a test called HbA1c. It has to be less than 6.5. Otherwise, we do not recommend them to go ahead with pregnancy. That can danger the woman's life as well as the offspring's life. So it is a very tricky situation. They have to get the blood sugar under control, and if the lady or the female person is having complications of diabetes, we do not recommend them to go ahead with pregnancy. So it is very important, both boys and girls control their condition optimally.
So end of the day, like this is a lifelong disease, it has to be managed throughout life, and if that is done, there can be a quality of life.
Yes, this is all what we call quality. We are giving quality care. We are trying our best to give quality care. It is up to you to take that quality care as we discussed. So we can manage it provided our society, our parents and children work together. If we all have to work together and get this under control, otherwise if one party falls off, we won't be able to get the control optimally.
Thank you, Doctor. On that note, we end this very interesting discussion on childhood diabetes. We place on record our grateful thanks to Dr. Navodha Atapattu, consultant pediatric endocrinologist, Lady Ridgeway Hospital in Colombo, for being with us on the program and sharing her expert knowledge on this very vital topic concerning children who can be affected with diabetes, and thereafter it's a lifelong disease that they have to manage for the betterment of their life. Thank you so much, Doctor.
Thank you.
Thank you too to Damayanti Kolombage for technical assistance. I'm Fatima Razikada saying good night and looking forward to your company next Monday, same time on Views on Health.